So you've heard two cases, two stories. We're going to take a break for you to ask some questions of our first two counties. Yes?
Hi, Scott.
Hello.
Yeah, one of the things that I've seen in our county is that we're still kind of, different agencies are still siloed. And what they're doing is they're still kind of moving towards an incarceration model than a case management model. And I'm wondering, how did you get everybody on the same page? I mean, that seems to be the big challenge for us.
Did everyone hear the question? It was trying to move from the silos to getting everyone on the same page.
Yeah,
what were some of the things that counties did to try to bring everyone together?
And move away from the incarceration.
And move away from incarceration, which Pedro and Scott talked about.
Right. So, I think both counties did a really good job of talking about how important the relationships are at the CCP, because that's where the action happens. And then, some of the leverage I use with limitations on entitlements to get my partners to think differently originally. But I think the other thing that we did was we just did it. We just started doing the CREW program and demonstrating its effectiveness right off the bat. The chief probation officer, for lack of other words, really fell in love with what we were doing, and he's the chairman of the CCP. In fact, the second time that we wrote a budget, so the second year of AB 109, we actually made the sheriff come back to the table 4 times before he was funded, because the group felt he was asking for too much of the same old approach. And I was flabbergasted, because I thought, I bring folks with me, like Sam Bernardino mentioned, to the CCP to help out, because they got firsthand knowledge. But I really thought we were going to have a knock 'em, sock 'em fight, and here all my main partners were putting other folks in their place as far as the approach. So the relationships, demonstrating success right off the bat, using limitations to force innovation, and just building those relationships.
Yeah, I think we had a great CCP. We didn't have those issues. Maybe with some of the law enforcement partners, which when we put 25 officers there, that really helped. We still face the challenge that a lot of our agencies come to us and say they want the list. They want the list of who's in their community, because they want to go out and be proactive. They want to get them off the streets before they reoffend. And it's having our officers there, talking with them, explaining to them what services we have, and getting them to switch their mindsets. We have one agency in our county, Fontana Police Department, who has bought into this so heartedly. They've started their own day reporting center. So twice a month they have providers come into the community and are meeting with the parolees, the PRCSs, and the mandatories, because they recognize that locking them all up isn't the way to go.
I think so. One thing we learned from 1991 realignment and with 2011, it's slightly different because the state's still kind of meddling and managing the revenue, which is different than 91, where it just came as a percent of the total, and that's technically how it should be. But initially, there's a lot of effort by the state to make sure things are falling out fairly and people aren't being shortchanged. But getting everybody at the table to understand that if we really are effective in what we're doing, we will get to the point where we are saving realignment dollars and building the flexibility to do things we probably could have never done before, because now we have the revenue for it.
And just to add on that real quick, also trying to locate individuals that are doing some of the work for you, to set up a strategic plan and a timeline, and take in consideration all the needs of each department. Like, what's going to make them happy, what are they trying to accomplish? So you set up a plan that it's, meeting everybody's needs, and, people are willing to work with you.
Andy? So the question is, did you find it difficult to get the faith-based organizations involved, and how did you incorporate them into the mix?
Well, faith-based organizations see these folk. They are the first line. When someone comes out of prison or jail, and they have nothing else, they're going to go to their church. That's where they go. So they were already housing, providing services. The issue is, if we go out for a request for proposal, will a faith-based organization, a mom-and-pop shop, have the infrastructure to comply with county rules and have their 3 years of budgets and have their $1 million insurance policy? And the answer is no. So what we've done is gone to the community. We have a reentry task force that's mostly faith-based, and we meet with them. We do some coalition building and some technical assistance, and advise them that perhaps they would be more successful if they combined forces and they had someone who's stronger fiscal lead. But they see our folks, and in our treatment providers on the alcohol and drug side, we have a lot of those folks who are already present, so they sort of spread the news to the other parts of the faith-based organizations. But they already see this population for free.
On our part for the faith-based, the way we work with them is we use them as our marketing piece, you could say, the education to the community. Like they mentioned, they're already working with our population. Just getting in there, I went to their Administrator Association meeting, kind of, give a presentation of here's what's going on, here's what you're doing already, are you willing to help, do you want to help, because basically, if we included them and said, you're doing the work for our community already, continue to do it, we really use them as the mentors and guidance that some of these reentry individuals need. That's the biggest asset I think we use from them, that mentorship piece.
And we have pre-existing relationships. We use our faith-based communities to run our food banks through the Community Action Partnership, which Pedro is technically an employee of and one of the many hats that I wear. And so we already have these relationships with them, and we have no community-based organizations in Glenn County. The three that exist, we've incubated and funded. So we've actually built them ourselves, and probably what could be perceived as negative is I have a tendency to hire those folks as county employees, and so I'm kind of taking them from one front and putting them on another, which is good in my eyes, but not always good in others.
Great, thanks. Other questions? Yes.
What are you doing about medical costs? You mentioned the 65-year-old. We're finding in our county that we're all of a sudden obligated to do liver transplants, and we're just taking on some massive medical costs.
So the question is on medical costs.
I would say that that was something that was one of the partners that wasn't initially at our table was our county hospital, our Arrowhead Regional Medical Center, which we have to address eventually. The good thing is that the low-income health plan did come in about the same time, and so we were able to get folks signed up for insurance that doesn't have the other requirements that Medi-Cal had. And we get creative with our funding. So we are, especially we see a lot of medical issues on our drug and alcohol side, and so if we don't have the funding through AB 109, which we usually don't, we are able to, are there any SAMHSA people in the audience? Okay, so we're able to use our SAMHSA Substance Abuse Prevention Treatment Grant money, which we use it appropriately, Tom. We do use it appropriately, but we use it when we need to. We have to get creative with our funding and be able to provide those services. And again, when we're working with community, we're able to get some of those needs met, but we haven't had, I hope we don't have the liver transplant issue come up, but we've got the sex offender stuff happening, but we don't have that yet. But hopefully, when we have a new round of funding, we'll bring our medical providers to the table.
Yes, it's just our LIP and our indigent health program is a multi-county program. We're in with a few other dozen counties, and as I mentioned earlier, they're a little bit more limited than what you would see with Medi-Cal. So, for example, house arrest makes an individual ineligible. So again, using that as a creative way to limit the amount of incarceration or the type of alternative incarceration to truly move the person into the community so that they can be served medically. When on those instances when that cannot be done, then supplementing jail medical with actually, I believe, the Excess Insurance Authority through CSAC provides, you can buy into catastrophic additional insurance for the county because of what's occurring with longer term stays at county jails.
And I'll put in a plug for CSAC Institute because we're doing a class on January 31st in Sacramento and then again on February 14th in Irvine on healthcare reform and its implementation in counties. And two of the issues we're looking at is what to do with the very populations that John's asking about, as well as what we fondly call the residuals, the people aren't going to be covered by insurance. So that'll be another place to explore that. Time for one more question, then we'll hear from our other two.
Do either of your programs have any kind of alumni feedback network from your graduates, and what's been the biggest surprise with those?
We don't have that yet, but that's a great idea. One of the surprises was that folks are self-referring for the things that they need, especially on the drug and alcohol side. I mean, we know that according to RAND, 66% of our California inmates have a drug and alcohol disorder or an issue going on currently. We know that's a huge issue. What we also know that our drug and alcohol providers are very versed in working with this population. This is our bread and butter. It's who we work with normally. So the fact that they really, folks really want to succeed. They don't want to go back to jail. They don't want to go back to prison. They want to be reunified with their family. So we just found that folks are really motivated if we could just give them the tools they need to be successful. And I think, again, with all of our programs, that's what we're seeing.
So in the video, it was hard to hear, but and I wasn't quite wearing the same outfit that I have on right now in that video. So Shiley, I first met in drug court as a totally tattooed out young woman, completely addicted to drugs, and was facing a 17-year sentence. And then when I handed her that graduation certificate, she really, although she wasn't dressed that nicely in that picture, she really, I would not recognize her. Today, she dresses like a CEO. And what happened with her that you couldn't hear was she found a chainsaw on the side of the highway and turned that into a business. And the way crew works is you have in-classroom training, and then you have county-run crews that do various programs, and then we cultivate positions in the community for full-time private employment, and that's the third stage that we move them in to. Shiley and other folks that have worked with her have come back to be mentors in the program in phase 1, then train them in phase 2 in her business, and then support them when they move into phase 3 out into private employment. So not only have they come back to mentor, but the program is starting to self-perpetuate itself because they're hiring AB 109 participants, and so you just can't ask for anything better than that.